Dr. Doug, when you mentioned the fact that people think that there's bloody tears, that their rat is crying bloody tears, I thought surely we have to discuss that because either it is bloody tears or it's a misunderstanding by the owner, but clearly a cause for alarm, at least in an uneducated owner, right?
Hey Tracy, thanks again for having me on to share some thoughts with the listeners. Yeah, it's interesting. I got an interesting case and came in just a couple of days ago as a young girl. She had a pet rat. She brought it in because it had a bloody nose and it was bleeding from its eyes. And of course, it was a white rat.
Oh
So
my
it
goodness.
it looked pretty awful and something out of a horror movie. Actually, it's actually not that uncommon. And rats, especially, they have this porphyrin in their tear, and it's a red color. And so when they produce these tears, they call them stress tears, then it looks like they're bleeding out of their eyes. And of course, there's a duct called the nasolacrimal duct that goes from the eye to your nose, or actually to the back of your throat. And so if you have these tears that are producing that are red, they drip down the back of your throat, they can come out the front of the nose, and it looks like they have a bloody nose and bloody eyes, and it looks pretty awful. It's a lot scarier than it actually is. Is it a problem? It's a sign of something not right.
Okay.
Is it lethal? The good news is no. Let's just go over some background about it because there are some interesting facts about it that people that own pet rats should know. For one thing, there's a virus that a lot of rats carry. The fancy name is called Sialodacryoadenitis virus.
Whoa.
It's easier just to
Yes.
say SDA. So
Yeah.
we call it the SDA virus.
Okay.
And a lot of rats carry this virus. It's kind of some people have the herpes virus and they can get it on their lips or other body parts. 99% of the time, it's never a problem. And every once in a while, the person gets stressed out, have a bad day at work, gets in a fight with their spouse. Maybe they get sick from some other reason. They get stressed out, and then the virus manifests itself, and it can be blisters on the lips or issues elsewhere.
Right.
So it never goes away. It just stays there. And most of the time, these viruses, like on the lips, they last for a week or so and then they clear up. The good news about the SDA virus in rats is the same way. Most rats that you buy in pet stores are going to have it. They're going to be carriers of it. Most people never even know. And most people, their rat will live its entire life and they'll never have a problem. But every once in a while, something will happen and there might be a stress event in the rat's life. And it could be something simple like the water bottle gets clogged and they go without water for a couple of days, or maybe you
Sure.
get chased by the family cat, or maybe there's some loud music. Who knows what it is? Whatever stresses a rat out can cause the stress, and then the stress induces the virus to surface, just like the human herpes virus might surface in a stress event. And then they get this red tears and the red bloody nose, or apparent bloody nose. And again, it looks really scary if you've never seen it. The good news is that most of the time, I'll just talk to the client and I'll find out what's going on, find out if there's been a recent stressor. And if there has, we try and correct that. The vast majority of the time, no medications are needed. One thing that owners and young veterinarians, especially that aren't real experienced, they want to just throw antibiotics at everything. And that's not good
Yeah.
medicine at all. And it's not healthy for the patient. It's not healthy for the environment. So most of these cases that come in that look like a horror movie, if you just clean their face up with a little bit of peroxide and assure the owner that it's going to be okay, send them home, make sure that they got proper temperature, proper humidity, proper bedding, proper housing, lots of tender loving care. Most of these cases clear up on their own just in a few days. At most, maybe 2 weeks. But like I said, most of the time, there's no treatment even needed. Now, that being said, if it doesn't clear up, first off, I don't recommend, if you have one of these rats that has this event where they have the bloody tears and the bloody nose, I recommend they take them into the vet just to check them. Because what if there's something else going on? Proper veterinary exam with a thorough physical, plus or minus x-rays, plus or minus blood work. It really depends, case by case basis. They're all different, right? So at least start with a proper history where you ask a lot of questions, and then a good thorough exam, feel the internal organs, listen to the heart and lungs, all that good stuff. Make sure there's nothing else going on. There are other things. The most common cause of respiratory illness in rats is a bacterium called Mycoplasma. And again, Mycoplasma is one of these bacterium that you're probably going to find in most pet store rats because it's that prevalent. And again, like the SDA virus, the Mycoplasma, frequently a rat can live with it its entire life, and it's such a low level that you never know that there's a problem. But again, you get a stressor, and it could be a cat chasing them, loud noises, improper food, lack of water, whatever the case may be. Now the Mycoplasma becomes a problem, and they can get a full-on, full-blown pneumonia from Mycoplasma. If you get stressed out with a pneumonia, then you're going to see the red tears and the bloody nose. These poor rats are in rough shape, and they need to be treated. That's a toughie because unlike the virus, the SDA virus, which is self-limiting, Mycoplasma, if you don't treat it, it's not, and it will kill them.
Wow.
So you can test for it. There's a blood test, a PCR test for it. I generally don't spend the money when I have a client come in that has a rat with red tears and a bloody nose, apparent bloody nose. I generally don't spend the money on the Mycoplasma unless they really want to know for sure. And the reason being is it's so common that if I take a rat, I'm doing a physical and I listen to the heart and the lungs and I can hear raspy lung sounds, I know it's got a pneumonia, or I take an x-ray, you can see the changes in the lung. You don't need to spend the couple $100 on the PCR test.
Nice.
That's where experience comes into play.
But if you had the pneumonia, that is when you would use the antibiotic.
You would, and in a perfect world, you'd want to go ahead and you'd want to do what's called a culture. You know how if think back when you were a kid, or if your children get a sore throat, they go to the doctor, takes a swab, and they say, and they stick the swab in your mouth. What they're doing is they're specifically looking for, but they're testing it, they put it on a bacterial plate, and then they look at the antibiotic sensitivities to see which the best antibiotic to use.
Right.
We can certainly do that in rats, but the problem is that Mycoplasma is one of these bacteria that are extremely difficult to culture. That's why you got to run the PCR test on them. Because Mycoplasma is so common, usually, at least me personally, when I see a rat with a pretty fulminant pneumonia, I will just go ahead and treat it for Mycoplasma. Now, you can certainly, and it's not a bad idea, to do a PCR test just to absolutely verify it. But the PCR test is not going to give you a sensitivity like the swab gives you when they swab your throat. But we also know enough about Mycoplasma to know what drugs to use, and that you don't use the standard ABC antibiotics with Mycoplasma. There is the DEF drugs that we use with Mycoplasma because it's a very different type of bacteria. You can put them on the medication and it usually clears it up. Sometimes it may take a couple, 3 weeks, but you'll clear it up, but you can't cure it. So you can't rid them of the Mycoplasma. So it will still be there. It will just be back under control. And then 6 months, a year down the road, the animal gets stressed again, the Mycoplasma resurface. So
it's the pneumonia that you're treating.
You're treating the pneumonia caused by the Mycoplasma.
But not treating the Mycoplasma because it's always going to be there. Born with it, die with it.
Yeah, exactly. No, they die with it, but they don't die because of it. They can die because of it if it becomes a fulminant pneumonia. So again, the SDA virus is one that the vast majority of rats you buy in pet stores are going to have. It's usually not an issue. But if the rat gets stressed, it does surface itself, and it usually surfaces as the red tears and the bloody nose, or the apparent bloody nose. Respiratory issues in rats are very common. And again, the most common cause is Mycoplasma. Again, the big thing is most of the time, it's never going to be an issue unless the rat is stressed. So the take-home message here, if you read between the lines, that is provide proper housing, proper temperature, proper humidity. You want to have good quality food, ample fresh water supply, good airflow, clean cage. All these stressors, the common stressors, aren't going to be an issue. And these things that these animals carry aren't going to be a problem.
And don't let your cat chase the rat.
Don't let your cat chase the rat. Don't put the rat cage directly under the air conditioning vent. Right. Common sense things that people oftentimes don't think about. But I do want to end with one thing, and that's very important. And that is in the One Health concern, where we talk about animal health, human health, and environmental health. And that's why I was talking about the antibiotics. We don't like just throwing antibiotics at rats or any animal, because what goes in also comes out, and that goes into your sewer system and goes in it. So we don't want to put antibiotics in the environment. You don't use them if you don't need to. But the point I want to make, the go home point is these mycoplasmas that rats carry, it's one of the diseases that actually is potentially contagious to humans. And it's called a zoonosis, which means animal to human disease. Now, generally, if the rat has the mycoplasma and they're not showing any signs, it's not going to be an issue. But if the rat is coughing and sneezing and got runny nose, yeah, you don't want to be handling the rat and then wiping your face, touching your eyes, eating your pizza or your Kentucky Fried Chicken because it's finger looking good, right? So you have to be very careful about using proper hygiene, especially around a sick animal. But you know what? Let's expand that and just say we use proper hygiene around any animal, whether
Yes.
it's a rat, a dog, a cat, a reptile, your pet hermit crab. Always, when you handle your animal, when you're done, proper hygiene, wash your hands, don't touch your face when you're handling your animals. If you do that, you're not going to have an issue. And I certainly never want to try and discourage people from having pets because of potential disease spread. The thing is common sense, which I know a lot of people forget to turn that on when they wake up in the morning. But if you use common sense, good hygiene, rats are great pets. I love rats. I've always enjoyed working with rats as patients. And rats they're incredibly smart. They're fun to train. They're responsive. And so I think they're awesome animals. Just be aware, treat them properly.
Okay, I have two questions for you. One is you said if you got your rat from a pet store, it could have either of these incipient, if you will, diseases. Is there another place to get a rat other than a pet store? For a
Breeders,
better job?
yeah, breeders. There's something that they call SPF animals, which means specific pathogen free. And these are
Oh,
animals that are bred specifically, and they actually test for them. They test the mama and the papa rat. They test them for mycoplasma. They test them for SDA. And if they are free, then they breed mama and papa together. Then the babies
wow.
will all be SPF, which means specific pathogen free. They won't have mycoplasma. They won't have SDA. But you're talking very expensive rats. These are animals that are typically found in research settings because you can't have an animal in a research facility that breaks with mycoplasma or SDA, something like that. But the thing is, most pet store rats, they're coming from just the common breeder. And most of the common breeders don't put the effort into sentinel animals and do testing like that.
So, are there any lab animals that are then released for adoption, or most rats end their life in the research lab? Not to be depressing, but I'm just curious, do they ever release those rats, or do people in research just don't think that way?
Of course, they care a lot about the animals, and sometimes they do, absolutely. Sometimes, and sometimes those animals are used as breeding stock for colonies of SPF that they use in the pet stores. So again, depending on where you buy them, it's always good to check the source. There are breeders that have SPF colonies, so they
Great.
can be found, but you just have to do your research to find them.
Okay, that's really good. And then my last question, which is just geeky. So, how small is the stethoscope that you use to listen to the lungs of a little ratty?
Oh, I wish I had mine to show you. There's different types of stethoscopes. There's the ones you're commonly used to seeing, which are the fairly
Right.
big ones.
Yeah.
And then they have what's called pediatric, which are much smaller. They have something called a neonatal scope, which are like super tiny, maybe about the size of the tip of my thumb. And so that's what we use.
Nice. Neonatal. Okay, good to
Mhm.
know. There's just so much always to learn from you, and it's always so interesting. One other quick question about these incipient or inherent illnesses. Is it like shingles in adults that it's been hiding, the shingles virus has been hiding? Or is that, or it's only hiding in people because they had chicken pox as a child?
Yeah, that's a little bit different. They had it as a child, and then what ends up happening is it goes dormant until later in life when your immune system weakens. Okay. And
Right.
it's the same thing with the pet rat because rats don't live that long, 2 to 4 years, maybe if you're lucky. So the longer they live, as just like with people, senior citizens tend to not have quite as competent of an immune system. So an animal may have SDA virus, may have mycoplasma, and its whole life it's very healthy. But as it gets older and its immune system weakens, sometimes these pathogens surface and they can be problematic.
Especially if you push the trigger button with stress. Play nice music for your ratty and read them bedtime stories that they like. Thank you so much, Dr. Doug. This is
You
really
bet, Tracy. It's always a
great.
pleasure.
Take care.